Positioning during preparation of the upper anterior teeth palate side. The innovation of the surgical microscope in dental treatments. In this presentation, I will introduce the innovation of the surgical microscope that has taken place in Japan. In the dental field, there are two techniques for using the surgical microscope. One is the conventional technique and the other is the microendoscopic technique, AKIYAMA. The surgical microscope's conventional technique is normally set at the 12 o'clock position using the mirror technique. My lecture's aim is to help you understand the microendoscopic technique, AKIYAMA. This video answers the microendoscopic technique method question, positioning questions regarding the tooth preparation of maxillary teeth. I would like to know the positioning of the tooth preparation on the palate side of the maxillary anterior teeth. Basic information from the book named the microendoscopic technique AKIYAMA method. This is the page on the right upper central incisor tooth positioning. Chair positioning is flat. Mandible is elevated, face up. Dentist positioning is from 10 o'clock to 11 o'clock. Use two joints of the surgical microscope. As you can see, this is the page on the right upper central incisor tooth positioning. I would like to know the positioning of the tooth preparation on the palatal side of the maxillary anterior teeth using the microendoscopic technique AKIYAMA method.
質問の内容っていうのは口外具体的には右上の1番というふうに聞いてるんですけど、右上1番の口外を形成するときにこのハンドピースが邪魔になるっていうことですね。でこのハンドピースが邪魔にならないように口外側を形成する 3D ポジションっていうのはどういうポジションがあるのかっていう質問です。
Positioning of the tooth preparation on the palatal side is performed in two locations, a distal side and a mesial side. Firstly, I will introduce the positioning of the distal side. The dentist takes a 10 o'clock positioning, use two joints of the surgical microscope. The patient takes a horizontal position, turn the patient face to the left. It is easier to perform the tooth preparation with patient's mandible is a little elevated. I will show you the microscope's image of this positioning in clinical practice. This positioning allows us that the handpiece isn't in the way of being obstructed when performing the preparation of the palatal side of the upper front central incisor tooth.
まず水平な状態ですね。で今僕は一般的なポジショニングをとってます。で患者さんが普通に右を向かせた場合にこの状態で口外を見ることができます。でまず口外の形成ですね。伸足が終わり筋遠心が終わった場合、口外のまず右上の1番の遠心です。遠心は患者さんを極端に左に向かせて少し頭を上に向けている状態です。で今映像上で見えるんですけど、両手で形成するっていう意味では遠心側はこの状態で削ると影にはならないと思います。まず遠心側はこう削る。
This is a video image of a surgical microscope for positioning where the tooth preparation from the distal palatal side at the right upper central incisor tooth. 右上1番の口外側からの支台歯形成を遠心側より行っているポジショニングの手術用顕微鏡の映像であります。ハンドピースは視野の邪魔になっていません。こちらは実際の治療の動画です。
で、同じ側から近親側は難しいので、近親側においては今僕のポジションっていうのは11時よりはやや10時寄りに近いと思いますけど、10時とかそのぐらいだと思うんですけど、次に患者さんを右に向けます。それでこの二屈曲している鏡頭を右に振ってきます。今見えてる映像は一緒にアップしますけど、で僕自身は顕微鏡を回転させながら、11時にずれました。で今映像を見てもらえば分かるんですけど、ちょっと拡大します。映像を見てもらえば分かるけど、口外側の形成はこの状態できれいにできると思います。でこの場合にはハンドピースは邪魔になってません。
Change the positioning because it is difficult to perform the preparation right upper inside the tooth. With the same positioning, I will show you the positioning of tooth preparation from the mesial side. Dentist takes 11 o'clock positioning. This time, rotate the microscope when changing from 10 p.m. to 11 p.m. positioning. Use two joints of a surgical microscope. The patient takes a horizontal position. Turn the patient face to the right. It is easier to perform the tooth preparation with a little patient's mandible elevated. This positioning can be possible that a handpiece isn't in a way of being obstructed when performing preparation the palatal side of the upper front incisor tooth. I will show you the microscope's image of this positioning in clinical practice. First, that video shows a tooth preparation of the upper front incisor tooth, the labial side. After that, showing the palatal side is performed. When performing a tooth preparation on the palatal side, it is difficult to perform with just one positioning. If we perform it, we can treat the tooth from the distal side and to mesial side, or from mesial side to distal. In that case of beginning to perform it from the distal side, a dentist takes 10 o'clock positioning. Use two joints of a surgical microscope. A patient takes a horizontal position. Turn the patient face to the left. Next, to perform it to mesial side from the distal side, the dentist change 11 positioning. This time, rotate the microscope. This is very important. When changing positioning from 10 p.m. to 11 p.m., turn the patient face to the right.